Hello, I'm Suhail Mirza, and welcome to Voices of Care. My guest today, when he was appointed as the Liberal Democrat leader, stated that he would be the voice of carers, and so aptly, Sir Ed Davey, very much welcome to Voices of Care.
Voices of Care, the healthcare podcast.
It's a privilege to have you here. Now, you've been on record as saying that the carers and being a voice of carers is fundamental to you. That's obviously a political and professional imperative, but your connection to social care and caring is profoundly personal too, isn't it?
Yeah, and I guess a lot of politicians take stuff from their private life and think about it and how it works in public life, and that's definitely the case for me. So my father died when I was 4, and my mum was widowed with 3 boys under the age of 10. And she was amazing, brought us up, but then she became ill with cancer. And then eventually it became terminal. And for 3 years, my brother and I nursed her at home until she died. So I was a young carer. I think I was doing stuff you wouldn't be allowed to do now, administering morphine and electric shocks and gosh, you name it. So as a young teenager, I was a young carer. Then lived with my brothers, lived with my grandparents, and particularly my Nana, my grandmother. I was very close to her. She looked after me. And then when she became frail, I sort of looked after her, mainly through care homes and sheltered accommodation and so on, but also a bit of personal care as well. And then my son, John, who's now 16, became very clear in his first year that he had some neurological problem. It's still undiagnosed, but essentially it means he can't walk or talk, although he's making a bit of progress, but he's going to need 24/7 care all of his life. So my wife and I, with support, provide care for him now. So caring has been part of my life and remains very much a daily thing for me.
And you bring that passion very clearly for anyone who observes to the debate around the NHS and social care. And just as a perspective, as a politician, but also as a parent and looking at the state and the commentary around the NHS and social care, the British Social Attitude Survey this year recorded the lowest level of satisfaction amongst the public for the NHS and social care since records began in 1983. Uncharted territory we're now on, massive waiting lists, etc. As you observe the landscape, what's your view? I think you've said that's the worst you've ever seen it.
Yeah, it's deeply troubling. And people, when they can't get a GP appointment, can't find an NHS dentist, waiting a long time for an ambulance, look at the cancer waiting times and all the rest of it that lie behind the findings you describe, are deeply troubling to people, and they're worried about their nearest and dearest. Employers worry about their employees. People are feeling this at a very profound level, and there's no easy fix, but there needs to be some long-term reforms, because if you look at the demography, if you look at what people are seeing in the figures for long-term health trends and long-term population trends, it's not going to get easier to fix this thing. So we've got to think both about the problem in front of us, but we've got to think long-term. And the political system hasn't been very good at that in recent years, to say the least.
No, and talking about this, let's zero in on social care firstly before we look at the NHS. Often the poor relative of the NHS in perception sometimes. The problem you've identified, and you've talked about this in terms of people not being able to access care, 500,000 people waiting for assessments. This is not a new problem. Social care and its reform and how we fund it has been around. I'm reminded of, I don't want to age you, but you've been in politics for nearly 30 years. But under the coalition government, the Care Act, the works of Dilnot, this was very well trailed out. It's been around for 10 years as a policy priority.
Yeah. Well, before the coalition, I was working with colleagues in my party, the Lib Dems, people like Paul Burstow and Norman Lamb and others, and we had identified a number of issues that the NHS wasn't delivering on. Mental health was one of them, and care was the other, in many forms, both social care and family care. And when we went into the coalition, we determined that we would bring those insights and those views to bear. And I have to pay real credit to Paul Burstow and Norman Lamb. I think they really worked hard. They listened to the sector. They were very much the driving force behind the 2014 Care Act. Obviously, it was looking at Dilnot Commission, which you'll remember, paying for social care, but it went beyond that. Assessment for carers, for example. And we had felt that we'd managed to move our coalition partners at a position that they didn't really want to go. There had to be some compromises along the way. It wasn't exactly what we wanted. But we got to a point and we thought there's been a degree of consensus behind this. And I was, one of the many things I was disappointed after the 2015 election, it just sort of was reneged on, particularly the paying for social care. And the funding of local governments meant that things like assessment for carers has just sort of almost not happened. And what it means is we have a legal framework. There's a lot of work being done, but it's not being implemented. Would we have to bring things up to date? Almost certainly. Was it perfect? No, it wasn't. But there's a framework there for hopefully the next government to look to and take forward rapidly. But we need implementation. We can't just have more words.
No, and the words one is reminded of, going back to Prime Ministers, of the commitment in the manifesto to fix social care. So let's see what the next government brings. But staying on social care, you mentioned the role of family carers, yourself as a young carer. It's often a group that's neglected in mainstream commentary. All the evidence shows that unpaid carers play a vital role, without whom the system would collapse, but they also need support in terms of respite care. And I think this is quite an important element of your vision for social care.
Yeah, I mean, we clearly got to look after care professionals much better, and let's talk about that in a bit. But I think care professionals would be the first to say, let's also look after the families and the loved ones and the neighbours and the friends who do the vast bulk of caring, inevitably. And I'm not talking about childcare, I'm talking about looking after disabled people, looking after elderly relatives, looking after spouses, the whole gamut. And it's really quite a tough thing to do. And one thing I hope we can do much better on is make people understand that care is a tough job, should be valued much more. And people who are doing it, even if you're doing it for your wife or for your son or whatever, your mother, you are doing something that's really quite important, and people need to both recognise that and support you. And I'm not talking about massive amounts of money either, by the way. Respite care isn't that expensive, really, in the scheme of things, when you're keeping the family carers going. Some training to help them do stuff. I wish I'd had training as a young carer. I was administering morphine without being trained. Can you believe it? It is astounding. We had this bell jar of morphine in my kitchen, and I'd empty it as a 12, 13-year-old. And so we need training. And I also think we need a better financial deal for carers. There's a big debate over carers' allowance, for example. It needs complete reform, an absolute disaster. And there are other aspects to how you would sort out the finances. I'd also, by the way, make it a lot easier for people who are able to work alongside caring to do that, because it keeps them healthy mentally and it brings more money in. Because people who are doing full-time caring for loved ones, guess what also happens? They're quite poor.
Because they have to stop working.
Yeah, you may have your loved one who you're looking after may have been working but had some illness which prevents them from working. If you then have to stop work, you might have gone from a double-income family to a no-income family just because of unluckiness of health. Now, is it right that we treat people like that in that way? And is it sensible in terms of the long term? Because you could help people get back to work.
And looking at the larger trends, you've talked about the demography with ageing population, comorbidities. This is going to continue to get more complex in the demands for carers, both the family carers and professional carers. And you have, of course, called for a cross-party consensus across health and social care. Can you expand a bit about that, particularly around the support, free personal care, and also how we're going to properly pay professional carers?
Well, as a Liberal Democrat, I've got loads of ideas about how I want to reform both support for family carers, social care, and the NHS. Of course I do. But I've been around long enough to know that if you make it just a political football, you will not get anything going. And we've just seen that. And my experience in government of having tried to get consensus and then being disappointed by the result. We've just got to get this. And that means we have to get everyone around the table. So I've called for all the main political parties to put in their manifesto a commitment to work cross-party to finally get an agreement on this, both what it would look like and how it would be funded in the next Parliament. And just imagine if we did that in the next Parliament. We got a cross-party consensus of how we're going to do this thing. I think it would be a transformatory Parliament.
Well, we've got a bit of evidence, I guess, to support that, because had the Care Act and all the reforms you talked about been implemented, I think the numbers are about a
million or so people will be getting care now who don't.
And that would be transformative to many
It would have been
people's
huge. And do you know, I think that had a huge benefit to our economy. I mean, we see it in terms of what's the right thing to do, looking after people properly, giving them respect and dignity. That's a value in and of itself. However, I think people see this just as a cost to the economy. I think that's just the wrong way to see it. I think if you get care right, particularly look at those long-term trends into the future, you boost your economy. I mean, look at the moment, the state of the health service is a drag on the economy. People who could be in work or want to work longer hours can't be because they can't get the treatment they need.
And I think if you said the contribution, I think the change of narrative has been called by other people, and Skills for Care has been on record as saying in their report last year that the social care sector, in terms of economic value add, contributes over £55 billion to the economy. That narrative doesn't get the mainstream press, so I think you're absolutely right. Now, we've talked about social care. If we can flip to the other side of the NHS, we've been very privileged on Voice of Care to having many of the most prominent chief executives and trusts within the NHS. There's a number of things that you've pledged in terms of conversations you've had around primary care, mental health, budgets. Many CEOs across the NHS landscape watch Voices of Care. What would you say to them in terms of what you'll be campaigning for post the next election?
Well, I hope it's not going to seem too simplified, but here it is, from my perspective. I think we've really got to have a radical transformation of primary care. More GPs, more paramedics, more NHS dentists, give community pharmacy a bigger role. So people can access healthcare close to them, get that advice they need for self-care, and all those trends, so people are kept out of hospital. Because they don't want it. No one wants to go to hospital, do they? And, there's lots of surveys suggesting that people are going to A&E because they can't get an appointment with a GP. I mean, it's crazy, terribly inefficient. Now, that means recruiting more GPs.
Actually, the number of GPs, despite commitments that were made, have actually fallen in terms of fully qualified.
And, retaining them is number one. Retaining them for longer, maybe bringing back people who've left the profession, trying to get more medical graduates to go into general practice and obviously train more students to go into medicine in the first place. So there's a whole range of things that we've been looking at with health experts to see how you would drive that. And, you could look at similar sorts of things for NHS dentistry, for community pharmacy and so on. So I have unashamedly, in the party, we've gone for a primary healthcare-led approach. I'd say it's much talked about, again, not delivered. And that's not to say we're anti-secondary or tertiary sectors. We want to take the pressure off them. Yeah. And, it seems to me, if the hospitals didn't have so many people rocking up, they can actually deal with, get some relief, take the pressure off. The flip side of that, by the way, is care. So two things. First of all, people not going to hospital as much because they're getting the care via their family, via a professional care worker, through the primary care. So they're not having to go to hospital, and there's not that revolving door. But also people being discharged really quickly. So one thing I've done in my own constituency, and I saw this actually through a by-election down in Devon, and met some people doing this in Devon, where the healthcare system had worked in Devon better with the social care system, where it was providing tailored support for family carers, where they would help the transition of their loved one out of hospital and help the family in the first sort of 2 or 3 months after their discharge. and they worked it through with the 4 hospitals across Devon. So I took that back to Kingston Hospital, my own local hospital, to say, look, can you empower carers of patients better so they can start the preparation of the discharge as soon as they're admitted to hospital, so you can think about how you can help them. And that's now being implemented and looks like it could be really successful. So your original question was, what's the vision for healthcare? Well, it's primary healthcare, stop people going to hospital. It's carers to keep people out of hospital, get them discharged more quickly. And both those things, I think, would relieve a load of pressure. So that, in a nutshell, is our priorities. And there's many other things. If Daisy Cooper, our health spokesperson, was here, she'd talk about lots of other things. But for me, that's what's driving me in what I want us to do.
And I guess part of that, there is some hope, for fledgling hope. You've talked about this, a great example of taking it from Devon to your local constituency. We have an integrated health and care system under statutory basis now, and that should have the voices of all, the third sector, social care, NHS. So perhaps there might be this community approach where actually access to training for family carers could be part of a bigger solution in terms of the people that we need to deliver these services.
There's the potential to do that, but I'm going to be honest, I'm a little bit cynical whether it's actually happening.
Fair enough.
I'd like it to happen. There is the framework, but when I talk in my local constituency, I'm not going to name any individuals, but for example, community pharmacists feel outside that model. They've not been brought into it. When I think of the voice of family carers, I don't really hear it in that model. And I'm not having a go at some of the health commissioners, but whether that's changed their mentality and the culture, I don't know. Because if you really are going to reach out to families and family carers, if you really are going to reach out outside the NHS family, to people like community pharmacists and so on, you do need a change of mindset.
Yeah, that will take time.
And I think, sorry to come back, I am going to talk about community pharmacists because I actually think they are a very underlooked part of the primary healthcare system. 1.4 million people go over the threshold of a community pharmacist every day. And they can provide lots of health engagements in a way which GPs and hospitals would find more difficult and way more expensive. And there are things that are not getting done. Let me give you one really weird example, and my team, if they hear this, are just going to laugh at me. And it's earwax removal.
Okay, we've never had that topic on Voice of Care.
I bet you haven't. I think there's probably a much posher way, microsuction or something. But anyway, if you think about particularly elderly people who've got hearing problems, 2 major issues. I'm not a doctor, by the way, so someone listening to this will say I've got it all wrong. One is hearing aids.
Yep. And
what's the problem with hearing aids? Not a problem at all, except people don't know how to maintain them, change the battery, and so on. If you're elderly and your sight's poor or whatever, I bet you end up putting your hearing aid in a drawer. I bet there are millions of hearing aids in drawers.
My own uncle has the same problem. So you're speaking to a converted.
So why don't we have community pharmacists who can help people with their hearing aids and be known for it? Second, why can't we allow community pharmacists who looks at your ears, says, well, you really need to have your earwax removed, and people are now being charged a fortune for it. I've talked to a community pharmacist, they'll say, well, we'll do it for 20 quid or 30 quid. You could even make that free. So, elderly person who's getting isolated because their hearing's going down, not going out as much, can't hear the radio, they're getting depressed, getting lonely, early onset of dementia. Why don't we think of prevention for diddly squat? No, it could cost you, save you huge amounts of money over the long term.
I think this will be a fruitful area of discussion post-election in terms of the community pharmacy.
So I'm sorry to go deep down into a particular issue, but it seems
I think it's illustrative.
It's like really common sense, the sort of stuff we can do.
Yeah. And you touched upon inclusion and a broader picture. And just want to touch upon that briefly. Obviously, compassion is a really important value for the Liberal Democrats. The evidence, unfortunately, shows from the King's Fund people with learning disabilities have far less access and take longer to access health services. We've got minorities who have poorer outcomes. So I think this is also an important part of how we're going to turn the dial in making the system fairer for everybody.
I couldn't agree more. As I talked in the beginning, I have a son who's got an undiagnosed neurological problem. He'll need 24/7 care. He has a father who's an MP. He has a mother who's a counsellor and a lawyer. And we struggle to get, we also we're financially well off, right? Compared to most people. We're very fortunate, very lucky, very supportive family. And I look at my constituents, people who, the parents have got learning difficulties themselves, or mental health problems, or English as a second language. And I think, how do they cope? And when they come to my surgery, if they get in touch with me, they're my priority, because they need someone to be their advocate. And we need a system that doesn't rely on the random chance that they go to their MPs, their MP can be their advocate. We need the system to automatically recognise these people need strong advocacy. And the system doesn't do that at the moment. It's quite a hostile system. And to speak with respect to children, young people, I'm excluding adults with learning disabilities for a second here, but children and young people with learning disabilities and their families. One of the challenges for local authorities is their budgets. And what happens is they're very worried about high-cost families turning up. Remember a few years ago, a family turned up with 4 kids with special needs, and it cost the council, completely out of the blue, in year, about £500,000 to meet their needs. Now, a small local authority can't really cope with those big costs. So my view is this: if a child, a young person with profound learning disabilities that's going to be quite costly, needs residential or whatever, that should fall on the national budget. Because the national budget's able, with all its ability, to deal with those sort of unexpected, unplannable costs. And that would allow local authorities to focus on the lower cost, higher frequency, high incidence type learning disabilities and give a much better service, and not be so we've got to protect our budget every single day of the week. And it could change the relationship between the family and the local authority so they can work together more. And it's those sorts of shifts in how the statutory sector works with the private sector, with the voluntary sector, with the families, that could, I think, make the biggest changes.
No, absolutely. One final question, if I may. We've talked about the NHS, we've talked about social care. Now, as you know, 20% of health outcomes are determined by the treatment you get, whether it's the NHS or social care, and the rest is the core social determinants. Now, I wanted to really take the lens back. Professor Michael Marmot's done some amazing work at the Institute of Health Equity, and this year, in January, he produced a report showing that 1 million people in 90% of this country died earlier than they should have in the decade prior to the pandemic. Now, I'm slightly, with some trepidation, going to refer to a conservative politician. Benjamin Disraeli wrote a book called Sybil, or known as The Two Nations, almost 200 years ago, bemoaning the division and the gap in health inequalities. And Professor Marmot now, nearly 200 years later, says, Britain is a poor country and it's unhealthy, to paraphrase him, where a few rich people live healthy lives. How are we going to address those fundamental, bigger determinants? It's a huge question, but we have an election coming up, and I have you and your wisdom.
Well, it needs another podcast to answer that question. But let me have a go on one or two specific areas,
Please.
which are, for me, are quite big behind it. The first is housing. I don't remember in the pandemic, we're lucky enough to have a garden, and my wife and I and the kids, remember that lovely weather there was in the first few months of it. And we'd sit out in the garden and coping, and I would think of my constituents who were inside very small accommodation, overcrowded. And by the way, there's loads of them now still in temporary accommodation, massive rise in temporary accommodation, constituents who are living in hotel rooms with a family. Now, if you want to talk about health outcomes, those are the sort of issues. How are we going to house people properly? How are we going to make sure that there's affordable housing? So this is quite close to home again because I met my wife on a Liberal Democrat housing policy working group in 2003, which probably means we should both get out a bit more. But it does mean that she and I talk about housing a lot because she's a social housing lawyer. She's now a councillor in my constituency, and she's leading our work on housing. And we've got the largest council house building programme we've had for over 40 years. And she is passionate about making sure that we've got that affordable housing that's, well insulated for noise and for energy, so people can have really high quality houses. And that makes a massive difference if people aren't overcrowded, if they can not have to hear their neighbours all the time, that their energy bills are low and they're warm. I mean, just imagine if we had that as a core to our housing policy. People's mental health, people's physical health, all those conditions from asthma to COPD to or the many health conditions which are related to poor housing can make it transformational. Now, that's not going to happen overnight, but imagine if we had a programme. I'll give you an insight to government. I was Secretary of State for Energy and Climate Change, and we were looking at fuel poverty. And we got this study which showed that for every £1 invested in quality homes that were warm and not damp, the health service saved £47.
That's a hell of a return.
So I took it to the Secretary of State for Health. People can guess who it was. And I said, how about giving me some money, working across the department so we can deal with damp, cold homes? I didn't get a terribly good response. But you see, I think a lot of this isn't as difficult as people make it out to be. You just go with the evidence, go with the analysis, and we could transform. We could say 200 years after Benjamin Disraeli, do you know what? We can see one country, one nation, without these awful inequalities.
On that visionary note, thank you very much for your wisdom and your time, Sir Ed Davey.
You're welcome. Thank you. Nice to have you.
My pleasure. If you've enjoyed this episode of Voices of Care, please like, follow, subscribe wherever you receive your podcasts. And if you want to learn more about how we're turning the dial on the debate in health and social care, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much and look forward to seeing you on the next podcast.
Voices of Care, the Healthcare Podcast.